Hi everybody, this is Eric with Motion Guidance. Thank you for joining me today for the Motion Guidance online course education series entitled Current Concepts in Movement-Based Rehabilitation. I am one of the owners of Motion Guidance along with Tal Blair. We are both physical therapists with our doctorates as well as sport and orthopedic specialties. The course objectives are going to be to discuss and review literature concerning modern motor learning principles, and we're going to link these principles directly into clinical practice or things that you can also utilize at home. We're going to be reviewing the anatomy, mechanisms, and importance of vision in rehabilitation, and not only discussing the benefits, but also understanding the detriments of utilizing this type of rehabilitation. We're going to present the research-based applications of assessment and treatment for proprioceptive deficits found in the head, neck, shoulder, trunk, and the lower extremity, including the knee. And hopefully this provides a stimulating learning experience and you'll be able to do your own hands-on lab learning during this course series. We're going to be going through a lecture portion as well as lab breakouts, as I just mentioned. We're going to be discussing aspects of motor learning pertinent to clinical applications, vision, skill acquisition, attention and performance, as well as discussing some different forms of feedback that you can utilize to the benefit of the learner. And then during lab breakouts, we're going to stop the lecture and allow you to practice. So have your clinician kits ready and your motion guidance devices ready so that you can utilize those at that time. If you'd like to, you can pause and come back to those later or continue through the education series and then perform those lab breakouts on your own at a later time. We will be discussing movement and joint position sense, assessment, and treatment, along with those reviews of the literature, and then those lab demonstrations will be the practice of those concepts. So let's discuss motor learning briefly and the different aspects of motor learning. If we keep this into a 30,000-foot view, the processing of information yields making decisions in our environment. So we have the decision of what to do based on information processing. So we take in a stimulus, we need to determine the appropriate response, go through movement programming, and then have those be applied into real-life scenarios. And we are doing this constantly all day long in both a conscious and a subconscious level. We also need to determine the type of feedback that's most appropriate depending on the learning and the environment as well as the learner themselves. So we get sensory contributions and sensory information, and there's different types. There's interoceptive, which is referring to inside the body. So this would be examples of headache, hunger, and performing different types of movement. We also have exteroceptive, which is going to be outside the body, proprioceptive, limb manipulations, and how they impact with the outside world. We're also going to be discussing the role of vision control, and that will be in the ventral and the dorsal streams of vision. Gaze control, which would be forms of saccades and smooth pursuits, and then also when vision degrades performance. So one aspect of including vision in our rehabilitation, as well as learning about how we can implement that with our clients and our learners, is that we can start to incorporate all different types of learning styles. So we have the auditory system, we have the kinesthetic or the feel system, as well as the visual system. And we need to combine those with effective feedback to achieve our maximal performance result. One of the issues with most clinical settings as well as at home is how to get that immediate visual feedback, and we'll be discussing some suggestions and some applications to be able to implement that. So when we talk about vision separately, vision operates different from other senses in the supportive skills. And this vision is based off of two visual systems. We have visual information that's delivered from the retina of the eye along two separate processing streams, and these are going to be the ventral and the dorsal streams. Okay? Both travel to the visual cortex. However, at that point, it is understood that visual information becomes much more specialized, and we'll talk about those differences. Okay? So here's a schematic of how those two pathways work, both going to the same area in through the cortex, but then the ventral pathway goes through a different system into the inferior temporal cortex, and the dorsal pathway goes more into the posterior parietal cortex from there. If we discuss these specifically, the ventral stream is going to be our conscious identification of objects that lie primarily in the center of the visual field. This helps answer the question of what is it? What am I looking at? What are the parameters of what I'm looking at? And therefore, it's severely degraded by dim lighted conditions because we want to see that very clearly. The identification of object information is then used for the conscious decision making and actions, and therefore the ventral stream has a very critical role in movement planning and initiation of a particular action. We contrast that with the dorsal stream, which is more specialized for movement control because it involves the entire visual field around us. So we're constantly processing information that we're not directly looking at. This answers the question of where is it, or where am I relative to it? It's operating on the unconscious contribution of fine motor movements without our direct awareness. And this is where we need to start processing more information appropriately into the brain, and maybe this area could be uptrained for appropriate decision making instead of just relying on the ventral stream of vision. So this is thought to help process the optical flow or the flow of light across the retina. It gives us information on time to collision and direction in our relationship to our movements from our environment. So we can utilize this system to also improve our stability and balance and our velocity through our environment and what's required. Smooth pursuit and gaze stability. The goal of smooth pursuit is to keep the target on our gaze fixed on the fovea of a retina. So the faster that objects are moving, they're characterized by brief fixations and rapid shifts to different locations in the visual environment so that the information is picked up during these fixations, but not during the saccade between fixations. The saccadic shift provides us with the capability to pick up information rapidly from a wide range of sources in our visual environment. And expert performers and learners can keep their eyes fixated for a longer period of time just before movement onset than non-experts do. So moreover, individuals can improve their performance if they are trained to fixate their gaze for longer periods of time just before the action has to be performed, and this is termed the quiet eye effect. Now, we've talked about a few different processing streams of vision, but new research really suggests that our complete processing is more web-like than it is linear. Okay, we have different functions in the brain, including things like the basal ganglia and the amygdala that help gain information into the processing of appropriate motor control and reactions to our environment. So we just have to keep in mind that the voluntary motor movements are procedural learning, their habit learning, their eye movement and cognition and emotion all brought together. Now, we just talked briefly about how vision can help us improve performance potentially with uptraining certain systems or treating vision systems differently in our rehabilitation. But we also understand that vision could possibly degrade performance. So if vision is dominated, especially through the ventral stream, and it collects our sources of attention, and this dominance does not always produce a positive outcome because we might not be processing appropriately in our peripheral vision. So an over-reliance can result in ineffective performance and decreased anticipation response in an open and constantly changing environment where it's hard to predict what is going to happen next. This includes both community integration as well as sports integration. So one of the major goals of return to community integration and to sports participation should be to move away from visual-based training and towards fast reactive environment training that require high performance prediction based on environment and experienced reactions. During this presentation, we'll be talking about the concept of layering to not only go through assessment and treatment of particular things that we find on our examination or challenges that we have with our particular patients, but also how to uptrain those different systems by adding things on. We'll discuss that throughout the presentation. So here's an example of how vision could be differentiated or a detriment to your performance. Okay, so this will be a video of a collegiate basketball player who's performing rehab in my clinic, and permissions were given to give this video as well as all videos. And she is going to be focusing on keeping a laser on a target on this wall and then bouncing a racquetball against the wall, but not moving her head to track it with her ventral stream of vision. This is a drill that will be optimized into utilizing the ventral stream processing to gather information, then transferring into the dorsal stream of processing to make appropriate motor movements to catch the ball on the rebound. I chose a racquetball in this case because it is a very dark blue, and that's going to be harder to have the eye understand based on light reflection where that object is moving through space. So if we look at this video, she's keeping a laser on the wall and not tracking the ball all the way through. And she has to make a prediction based on how fast she's throwing the ball, where it hits on the wall, and have that also come back up into her hand. And as you can see, she is not very efficient with her motor planning. She reaches out and really aggressively tries to go find that ball. And in that case, it went through her legs and she missed completely on that last attempt. Okay? We would like to train that visual field to uptrain or increase the effectiveness of her dorsal stream so she can better predict what movement she needs in order to grasp that ball effectively without wasting motor efficiency. We can also do that with things like a sport ladder on the floor, and instead of looking down through that sport ladder, have the gaze maintain up while still understanding a closed environment beneath her. The closed environment referencing it's not going to change. She has a prediction based on predetermined understanding of the environment, and then she goes through. So this is a common training that many people do to increase their motor efficiency. However, if it's completely reliant on vision, then that might degrade if the environment starts to change or if the vision requirement changes. So here's that example. So she has a laser up on the wall from her head, and she's going to be keeping that laser up in front of her. Okay, so you can see how the laser dropped down toward the floor as she wanted to change directions, okay, and going forward and backward. Even more sport specific or more requirements in demand, we have a professional basketball player who was playing in the European League. He had had a previous neck injury, so we decided as he was progressing through his rehabilitation to not only perform the skill that he needs, but also layer forms of dorsal stream reactive vision training. In this case, he's going to be dribbling a ball with the laser up on the target on the wall, and then the racquetball will come in from an external source, hit on the wall, bounce up, and he has to predict where to catch that while maintaining the original motor performance of dribbling. Okay, so let's go through this. Okay, so he was not able to get that one. This is a first attempt for him during a series. Okay, so he missed that one as well. It hit his hand, but he wasn't able to get the fine motor grasp. Coming off there, he was able to get that one. He tosses it back over his shoulder, and he misses that final one. Okay, so we're doing this with just one hand at a time. Okay, and he's doing a very good job of maintaining the laser on the target, on the wall, and then creating prediction based on how fast the racquetball is coming off the wall and the ground, and at what angle and where he needs to put his hand. Okay. If we look at the second video, okay, as we travel through, this is his second attempt after a break and giving post-performance feedback. He starts to get every single one on this particular series. Okay. Now, as he goes through that particular skill set with basketball, we can translate that over to other things. So this was a collegiate long jumper. Okay, same type of idea. We're going to put him jumping onto a BOSU. It's a closed environment that's also unstable in this case, and he's going to be keeping the laser on the wall. He had hurt his knee through the jumping phase, and he needs to go through his motor planning and maximum performance without reliance on vision, especially during the the contacting of the sand. So this is trying to get just subtle perturbations, good prediction, maintaining his vision forward and utilizing his peripheral vision to make good decisions just in anticipation of returning to his long jump. So let's look at this one. Okay. So he's going to step off of this. Okay. He's going to stabilize the BOSU, get through a predictive direction and land, working with perturbations with the laser on the wall. Okay. Now, we had seen one of our video examples of using a sport ladder on the ground, and this is one of the common things that we see with people posting through social media or have done these before. These drills are not bad, but if they're not including some sort of open environment change, they're not going to translate directly over to sport and the requirements to return to most sports. So this is good for muscle coordination. It's good for maintaining an aerobic workout. Not good for returning to sport-specific training, although this is plyometric in nature. If we take a different look at these type of activities, if there was a ball that was involved coming in from the environment, another player coming in through the environment, these drills would not work on that reaction in the brain to make appropriate decisions. They would be linked to just doing the ladder. Okay? So we have to have different aspects of motor learning, but then link those into real-life applications. And that's where we have just gone through how we can utilize vision, but also understanding that there could be detriments to only focused vision training. So now let's get into the optimal learning research, which is an acronym put forth by Gabrielle Wolf out of Nevada, Las Vegas. And it has two different components to the Optimal Learning Center. It's motivation and performance, as well as attention. Under the motivation and performance area, it's going to be enhanced expectations and autonomy of support. So we're going to try to enhance motor learning and performance through increased feelings of relatedness, competence, and autonomy, and ownership of behavior and practice. And then the attention side tells us that we have to have a component, external focus of attention, where the focus is on the goal of the task and not the task itself. This is directly taken from one of her publications, and it's a schematic breakdown of the components that I just mentioned. We have the motivation side with autonomy and enhanced expectations, and then we have the intention side with an external focus of attention, where the focus is on the goal, not necessarily the task, and the feedback system continues to loop through. If we look at the results of the study in graph form, the highest levels of retention, which equates learning in this case, was linked when we get all of those components, all three of those components, together in the same learning environment, performing the same skill, rather than breaking them out. So they refer to it as the triple play, including enhanced expectations, which is in creating an environment of success, utilizing augmented feedback. We'll talk about that later. During novice skill acquisition, autonomy of support, active choice participation from the task performer. Instead of necessarily telling them what to say, they have a say in the performance of the task. And then the external attentional focus, which is attention placed outside the body during the performance. We can take this archery target as a form of explanation for enhanced expectations. If we present an environment where the learner understands that there will be optimal success as well as failures during their repetitions, that might be a detriment when they are learning a new skill. So in this case, if we painted the whole archery target a blue color instead of a bullseye progressive into the center of the target with different coloring, just hitting the target would be a form of success. This would be an enhanced expectation of how to learn. Now, as the learner progresses through their performance, we can, of course, enhance that even further by having them understanding what's successful and what's not successful. The autonomy of support in a explained model is going to be they understand the goal of the task, but they can achieve that and how to get that by making their own decisions and giving them some autonomy during that performance. So in a simple way, clinically, you might have a patient who needs to get up and move around their room in the hospital or in your clinic with their walker or their assistive device. Having them have a say of which direction they want to go through the hallway actually usually enhances motivation and learning for that particular individual. From a max perspective, there can be a rote application of warm-up exercises for the expert learner, but then maybe giving them suggestions on which route to run might not mix as much as what they want to do, and then coming back around and doing the things that they had less interest in to maximize their learning and performance and keeping their engagement high with their motivation. On the attention aspect, external focus, as a explanation through this picture here, is going to be that you're focused on their internal body part versus just the goal of the task, which is getting the ball into the bucket. So the external focus of the attention as a description would be toss the ball into the bucket, and the internal focus of attention would be my hands need to release this at a certain angle with a certain velocity and a certain arc in order to get it into the bucket. Now, we'll come back around to more examples of the optimal learning publication from Gabby Wolf. But as we start to implement all of these things, we have to remember that there's going to be an auditory, a kinesthetic, and a visual portion to learning, where we typically get as a deficit in what we can give our patients is that we're not giving them enough visual-based learning. We tend to communicate through our patients through strong auditory and kinesthetic cues. So if you look at the middle picture of this slide, you have a person in quadruped. The expert in this case would be the skilled practitioner putting his or her hands onto the pelvis and then giving auditory cues. So we need to make sure that we're giving some sort of visual feedback as well, as this is the primary learning style for the majority of the population out there. Okay, so are we giving too much touching and auditory cues, or can we switch that? The motion guidance device allows us to switch that and give immediate real-time visual feedback in the form of an external focus of attention to allow for optimal learning of skill acquisition from the learner. So other current and previous research findings suggest that giving insight into how to improve our motor learning and body awareness and outcomes, replacing an internal focus with an external focus yields automaticity and efficiency of movement versus an internal focus yields unnecessary movement patterns and muscular activity. If we give extra definitions to these terms, internal focus is the individual's attention to draw the body part in question. It is drawn internally. An external focus, as I previously mentioned, is drawn to an external object or a mental image outside the body. I mentioned augmented feedback. That breaks down into feedback received by a subject from their social surroundings. It's typically in the form of knowledge of performance and knowledge of results. Implicit feedback is easily understood with minimal detail. Implicit feedback is something we typically want to start our novice learners or introduction of a novel skill into different learners. Explicit feedback is very detailed. Okay? That can be a detriment to a novice learner. We just want them to focus on the goal of the task, and as they do more repetitions of that, we can give them more information to change that type of feedback to explicit. So we want to be cautious as practitioners to not give too much explicit feedback early on in our exercise performance or our skill learning versus implicit feedback. Another publication here in JOSPT where the authors suggest or give examples of different forms of internal feedback versus external focus of feedback. So if we say stand on one leg and slowly bend, keeping your knee over your foot, versus stand on one leg and slowly reach toward the cone with your knee would be a form of external focus of attention. Another example of internal focus was jump as high as you can and reach your fingers as high as you can, versus jump as high as you can and touch the hanging ball. So the hanging ball would be that external focus of attention. One final example would be bring your head back to the same position each time, and versus bring the laser back to the target. That'd be that external focus of attention if we were using a motion guidance system. Okay? So augmented feedback and giving feedback influences learning. So information from measured performance outcome that is fed back to the learner by artificial means, that knowledge of results would be the success of the action, It may be critical when inherent feedback is absent or incomplete. That inherent feedback would be from the learner themselves. And knowledge of performance is typically an internal focused process. This different types of feedback could have motivating or discouraging function and can be combined with other information to generate new knowledge and can help the learner's attention either toward the production of the movement or towards the end product of effect of the movement in the environment. Can also eventually be detrimental if the learner becomes too dependent on this type of feedback. So typically they want to take what they can feel inside their body and what they know is their performance and mix that with the knowledge of results and knowledge of performance and not give them too much information. Now we're going to go through some examples of different types of feedback to challenge you on what type of feedback you're consistently giving your learner and see if we might want to change that. How often are we giving the same types of feedback despite what type of learner or type of skill we're utilizing? So we might find ourselves jumping in too quickly to correct movement before a foundation of learning of the general skill is accepted by the brain. Or is that even appropriate for a particular learner, or is that going to provide detriment? So understanding different types of feedback could have enormous function on the learning curve of our skill acquisition. So we have forms like absolute feedback, which refers to the total number of feedback presentations given to the learner across a set of trials. How frequently are we giving that? The relative frequency of feedback refers to the percentage of trials receiving feedback. So that would be like having an A group and giving feedback, having them perform a B group and not giving feedback, and then determining when they get feedback later. Faded feedback is probably the most commonly given in clinical settings, where the instructor gradually provides less and less feedback on performance the more repetitions are given. So once the goal of the task is understood, as well as some feedback on how the learner is performing those tasks, we let them independently determine how well they're doing the more they do. Blank trials would be a form of no feedback. I'm going to let you go through this and determine your own knowledge of results and knowledge of performance, and then we can come back later and give you delayed feedback. Blank trials are probably the most consistently given due to a lack of equipment in most clinical settings, where we let them perform and then we show them how they did later. And oftentimes that time gap is too much for the learner to remember exactly what was going on, or what they remember is different from what actually happened. So giving immediate performance feedback can help bridge that gap, and that's where motion guidance can come in for your clinical setting. Now, bandwidth feedback is only given if the performance error is outside a predetermined score. So the learner is told ahead of time what the criteria is. So if we give that archery model that we discussed earlier with the optimal learning model, we can tell a person if they are outside of that score where they can interpret that themselves. And then we can give them feedback of how to improve that. It produced faded feedback as a byproduct, and performance improves. Rewarding feedback is linear with this performance typically. Now, one of the most powerful ways to deliver feedback is while the movement is ongoing, pushing the movement closer to the action goals. So in 2002, Chivakowski and Wolf revealed that learners tend to request more feedback more frequently following trials that they perceive to be performed well. So that motivation stays super high. If you have a skill that is producing too much feedback or result that is outside of the standard of what is considered a good trial, you might want to consider either sectioning that motor skill out into two separate pieces or performing a different skill. Okay. So there may be more important motivational components driving the request for feedback, which in turn has a beneficial effect on learning when feedback is delivered. That's what we want. So motion guidance fills this space and the demand, as I mentioned earlier, on some type of visual feedback to determine whether both the learner and the director of the skill can match the feedback that is needed or change the skill at that time. Okay, so we have discussed external focus of attention, we have discussed enhanced expectations, and we've also discussed autonomy of support. Things that can matter could be forms of internal feedback, augmented feedback, and of course some type of summary feedback or different forms of faded feedback. So let's take a quiz right now on just the information that we've acquired through this introduction, and then we'll move on into the head and neck. So the most important variable for learning is performance of the skill itself. Where there's going to be different components of whether a person can maximize that performance, but the person needs to do the skill acquisition over and over in order to determine improved retention of that particular skill. The faded feedback concept during practice describes the ability to start taking feedback away from the learner the more they perform those trials. Inputs from our peripheral vision are processed along the A, ventral, or B, dorsal pathway. The answer there is going to be dorsal. The major components of the optimal learning model are external focus of attention, autonomy of supports, constant practice, or enhanced expectations, or A, B, and D. The answer there is A, B, and D. Okay, so that finishes up our lecture portion of the introduction of the Con Ed model for our online learning. I'd like for you to take a break right now. Coming up next is going to be your head neck section, so get your clinician's kit ready, and we'll have the lecture mixed with breakouts during that section.